You know, people often ask me, how do you find a spine surgeon? Or how do you find a doctor of any sort? And that's a great question. When you think about it, what is possibly more personal and more important than your health care? Nothing. Yet you trust your health care to people you've never met. How do you know? You can ask your family doctor. I recommend that. Your family doctor often will know who has taken good care of his patients in the past, who gets good results, who do the patients like. That's a good way to find a spine surgeon or to find a doctor for that matter. You can ask someone who's had surgery. That might or might not be helpful. One thing you shouldn't rely on entirely is an internet search. The internet, in my experience, is a brochure for sales. And you really can't get a sense about the excellence of a spine surgeon based just on their internet profile. You need a lot more than that. What I like to do is I like to ask the nurses who are around the doctors, ask the OR nurses who see these surgeons, and ask them, who's good? You see them all the time, who's good? Tell me who you would send your family to. I think that's one of the best ways to find a spine surgeon or a doctor in general. Ask the nurses at the hospital, who would you trust your cardiologist as your cardiologist? For us at Sonoran Spine Center, one of the things that we like to do philosophically is we like to give patients their options. We want patients to know they have a choice, and their choices are these different varieties of care. So when they end up choosing a doctor to pursue their health care, their care for their painful back or neck, they'll know that if they come here, they have a lot of options. We insist on reaching a diagnosis. Options and a diagnosis lead to good choices going forward. And the choices that you make and the doctor who helps you through those choices makes all the difference in the world in how you'll do. In the end, the patient makes the final decision. That's our philosophy here. We offer the choices, we help them develop different options and plans, and then we choose the best treatment plan that will work with the patient and for the patient. But it's up to the patient to choose what would they like to do. That's our philosophy here.